I'm Siggy Joseph. I'm a GP in Midlothian and I specialise in women's health and looking after the needs of our female patients. There's quite a number of people that might believe that the menopause can just be a sudden event in their life. The term itself does relate to a period of time that's 12 months after your last period, but we know that the symptoms can last for years or months before that date and also for some time afterwards. Patients can experience a huge amount of symptoms that can range from mental health symptoms like sleep disturbance, forgetfulness, brain fog, anxiety, and then you can get a lot of physical symptoms. Some patients get palpitations, their bleeding pattern changes to skin and hair, and weight particularly as well. So there's quite a lot of things we can do in that period of time before your actual official menopause to try and help control the symptoms and to make things more comfortable for you, such as night sweats and daytime flushing as well. And so it's about getting the right help. Find some information, there's a wealth of information. There'll be information on NHS Inform. Speak to friends, speak to your partner, get the support you need from your primary care team if needed. It's not always the doctor you'll speak to, but when you speak to somebody within the team, they should be able to signpost you to places to get help, perhaps medication and things that we can do to help you in that period of time. To experience menopause in a more positive way, the more information a patient has, the more empowered they can be to get the right help that they need. So I would encourage everyone to look on NHS Inform for that information.